Treatment and management of the vertigo. The episode of the vertigo varies from few seconds to several hours or the several days, according to the pathology occurring in the periphery, in the inner ear or the central nervous system, that is the vestibular nucleus. Now you should reduce the factors which stimulate or trigger the episode of the vertigo. Reduce the intake of the alcohol. Then smoking habit should be quitted or reduced or controlled one. Intake of the nicotine and caffeine should be reduced as far as possible. Now lie in the or the rest in the dark room, which should be quiet one, to avoid the photophobia and the sonophobia. Take maximum quantity of sterilized water to fulfill the requirement of the body, to boost up the immunity of the body. Next, the drug therapy is anticholinergic drugs, that is hyoscine hydrobromide. Hyoscine hydrobromide, which is also a sedation factor also. Anticholinergic. In addition to these medicine, then there are antihistaminic, cetirizine, and meclizine. These are the medicine used, especially strugeran tablets, strugeran capsule, compound capsules. They are mostly used for the treatment of the vertigo, acute vertigo attacks or the episodes. Typhine, dimenhydrinate. These are also the antihistaminic one. Now, when there is vestibular neuritis or the vestibule inflammation of the vestibule or labyrinthitis, then we have to use according to the pathogen which is producing this inflammation, that is whether it is virus or whether it is bacteria. So antiviral and antibacterial or antibiotics are used accordingly to reduce or control the inflammation. Next we can also use the steroids for a few days, especially methylprednisone, dexamethasone. They can be used oral, the systemic, that is intramuscular IV therapy for short duration, because they have anti-inflammatory and prompt action to overcome the emergency and the rapid treatment and recovery of the patient. So complication of the vertigo is there is hearing loss, but hearing loss or the defect is produced only when the vertigo is peripheral vertigo, that is defect or pathology is in the ear, in the inner ear. While in the central vertigo there is no loss of hearing. Then there is nystagmus, diplopia. These symptoms, they are mostly due to the central vertigo. That is when the defect or pathology is in the central nervous system, the vestibular nucleus, which is located in the cerebellum, that is the brain stem. So this nucleus receives the signals, sensory signals from the inner ear, and interpret or understand those electrical signals, and then according to the capacity or the inherited capacity or potential power, that produces the order accordingly to the periphery, that is through the spinal cords and various nerves to the muscles of the body, or the other systems which are responsible for the activity of the person. So vertigo is a disturbing symptom which disturb the normal lifespan or the normal routine activity of the patient. So this has to be treated immediately. It can be reduced, though it cannot be fully treated, but it can be managed, and the patient can get satisfactory result by the medical therapy, physiotherapy, and psychotherapy.